I hope all of you can hear me. Just send a message in the chat box that the sound is audible, and let's get going. So, friends, here we are on the subject of scalp acupuncture. Scalp acupuncture is defined as a microsystem. And if we observe very carefully, not very many people are using scalp acupuncture because the fundamentals are not very clear. We have done a lot of research on microsystems, and last year during our annual conference, ASPICON, we demonstrated instant relief on more than 5 or 6 participants. Those who were suffering from different conditions, they got the relief on the spot. And we took our research further and we discovered some wonderful facets of the science. As a rule, microsystems are those systems that connect to the most active chi. Now, this is very important because when we don't connect to chi, we don't get results. And amongst all the microsystems that exist, scalp is possibly the most vibrant, the most powerful microsystem if one can use it properly. We all know that there is a traditional Chinese scalp acupuncture with its charts. Then there is a Japanese scalp system, and there are other couple of systems linked to the scalp as well. But we found that with our own research that the scalp has not been fully understood. So I will introduce this concept NASA, New Advanced Scalp Acupuncture, which is a step forward which will give you more control of what you are doing. First, I will invite Dr. Chirag, who has worked with me on this system, and he will explain some of the fundamentals of NASA, and then we will go ahead with understanding some dynamics of the science. Please remember that we are holding a full day workshop in February to make you a professional, to make you an expert in this science, and you will be able to use it for the benefit of your patients. So, friends, I invite Dr. Chirag on this group, and he will explain what is NASA and the new techniques. Welcome, Dr. Chirag. Evening, everybody. Um, it is great to be here today and for this opportunity to talk to all of you. Now, let me get to the point very quickly. We will go through three main indexes. The first of which is understanding the scalp. Now, when you have to understand the scalp, you have to not only understand the anatomy, the physical structure, but also the energetic structure of the scalp. Secondly, we will talk about the prevalent applications, means what techniques are present as of today, old, new, advanced, whatever. We will describe those. And lastly, I will present two cases which have been treated successfully and are also currently under treatment with this new method. So now let's go to the scalp. Now, before I explain the scalp to you, all of you all must follow this diagram, the second one. Sorry, yeah. So this diagram becomes very important. As you can see, almost all of our yang meridians either end or begin in the head. Now, why do you think that is? What can be the reason for this? All yang meridians or yang energy in general is the most vibrant, most active, and brings about functional change in the body. And also, the top of the body, especially the top of the head, is the yang most region of the body. So the energy there is most active to bring about any functional change in the body. So with this diagram right here, there is a representation of all our channels on the scalp. This is traditional Chinese acupuncture system. Now, as an example, we have used DU 20. Almost all of us use DU 20 day in and day out. And why? The reason is because it relaxes the body, it opens up the energy flow, and it helps you open up more energy blocks for pain, back pain, migraine, sinus, whatever those pains might be. We always try and give DU 20. So, moving a bit forward, in the scalp, you can just divide it into two parts. One is the benchmark, which is the hairline, and the second benchmark, which is the suture linings in the scalp. Like this, when you just look at the bone, there are four major sutures you must be aware of. As you can see on the lateral side, one is absolutely on top and one is at the posterior, and the other is above the ear covering it. So over the last 1 year, as we have been working with NASA, what we have realized is that the most vibrant chi of the head, which is the yang energy, it spreads through the scalp area and it seeps out through these sutures. It's just like you are watering a field for the very first time. So as you are born, the chi starts flowing onto the scalp and growing. Another example that I might be able to give you is when a person is healthy, you say there is a glow on his skin, there is a silkiness to his hair. It seems like a sign of vitality, that the energy flowing through him is good, is strong, is free of disease. And the same thing, when you see a sick person, you look at his skin and hair. So just like that, when the chi is strong, when the chi is flowing well through the body, through the meridians, the hair on the head is good. So that should give us a clue that the entire margin of the head is very important if we want to tap into that chi.
Rabane do.
So, with this in mind,
Adi
we
ko ane
go
do.
ahead and we understand what are the prevalent applications of scalp acupuncture as of today. Now, basically, there is the Chinese system and there is the Japanese system. The Japanese system was introduced a bit later in the year 1971, but the Chinese system came much before that. And what the Chinese did is they mapped the motor areas, the sensory areas based on the neurons in the brain, and they stimulated those points on the scalp. But what the Japanese system found was there were specific points of pain or sensitivity on the scalp associated with a particular region of the body. For example, if you have lower back pain, the point D in the YNSA system used to be very active. Now, this is the comparison. This is the Chinese system where you have all the mapped areas where you would needle and put electric stimulation that would happen. But on the other hand, you have the Japanese system where it was all about 3 to 4 points and giving maximum and instant pain relief. Now, over the last 1 year, we experimented patient after patient of pain. And what we found is that the new Japanese system, it provided much better pain relief, but not complete. If I would give the point, the patient would feel relief immediately. But again, after a day or two, it would come back. Not as severe, but yes, it would come back. So that made us think ahead. What are we not doing in this system? What is remaining?
The
So we combined the Japanese system with our own traditional Chinese medicine system to complement and complete the circuit of pain. Now, with this interesting approach, we found even greater success and even greater pain relief in patients. So, this is the background, and with this background, I'll present two cases for you. The first case is of a 89-year-old lady who had got canal stenosis, who still has actually. I met her just a week back. Today is the 13th. I met her on the 5th or the 6th of January. I was called home and she was like, I cannot get up from my bed for the last 3 months. I have to do everything on my bed. Even if I sit, I can sit maximum for 15 minutes and the pain is unbearable. I have to lie down. He examined the MRI, did everything, and it was a canal stenosis. Now, all of you who've been treating back pain, who've been treating canal stenosis, are familiar that it is a stubborn condition. It takes time. It takes repeated treatments. It takes a lot of effort to get the patient out of it. So I said, I have a new technique and I would like to try this for her. Now, as soon as I gave the first point, she said there is some relief, but still I have pain. Then I decided, as this is more stubborn, I need to give the main channel point as well. So I gave the second point, and with that, she felt that there is some bubble traveling from the head right back down the spine, and something is releasing. Now, when that happened, I realized yes, the actual work has begun. That actually the chi has started to mobilize, and the pain relief continued for almost 30 minutes. So when I gave her these 2 points, I completed the circuit on the head and on the, sorry, just a minute.
Awo, Papaji, aye,
Sorry.
aye.
So it was all about completing the circuit. of pain.
Koi kauri.
The next day I went. She said, Doctor, that day I felt much better, but next day just 10% pain came back. Now I gave the same set of points again and again, the same repetition. A bubble releasing from here, traveling all the way back down, and this time it went further down to the leg. It completed the circuit. It literally cleared the whole channel of blockage all the way down to the ankles. Third time I visited her, she said, Doctor, I sat for 2 hours today in front of the TV. Now, this is an 89-year-old lady with canal stenosis, which is a very stubborn condition to treat. This was the magic of this new system of scalp acupuncture. Traditionally, it would have reached there, but maybe after 7, 8, or 10 sittings. So you see, we are saving time, we are providing relief with minimal amount of needles. That is the main point. Now, just like this, I would like to present one more case. This is a rheumatic frozen shoulder with spondylitis of the entire spine. So this is a 56-year-old lady who came with a very severe left frozen shoulder. She could not even turn her head. It was that bad. Means the whole shoulder, the SCM muscle and the neck, everything was stiff. And in the complete case taking, she was menopausal. And also I asked her, have you done your rheumatic profile? She said, yes, I'm ANE positive. So I told her, ma'am, this condition usually takes a lot of time, but let us try and see what we can do with this new system. So same principle, I gave her the point which represented the shoulder and the arm because the entire thing was connected. So I gave her the shoulder and the arm point, and she said that immediately she felt that she could move a little bit. Now it was not as dramatic as she could raise her hand up, but yes, she said, I couldn't even do this much. Now I can raise it to about 70 or 80 degrees. I'm like, that's good. Now, again, from my previous experience, I gave her the channel point as well. And when I gave her the channel point, she felt even more relief, but not as dramatic as the last patient that I described. She said there was a sense of lightness along the entire spine as if something was releasing. Now, this is the Dechi. This was the proof that chi is mobilized and it is working. We kept the needles in for about 20 to 30 minutes. And at the end of the treatment, she said that that night she slept the best in 6 months. Again, when I saw her next, we did a similar protocol, repeated the points, same relief, even longer duration of relief. Now, I have been seeing this patient for the last 2 months. In 2 months, her mobility has returned completely. Her spine, both cervical and lumbar region, flexibility has improved, range of movement has improved, pain has reduced dramatically. So, all possible with just 2 or 3 needles placed perfectly and observing the Dechi. So, this is the potential of this new system, and we will be extremely happy to teach this system to all fellow participants. Now, this is my cue for completing the presentation. I hope I have given you something to think about and apply. And I will ask my father, Dr. Mayank, to carry forward, please. Thank you. Well, friends, this was some practical inputs. Now let us understand some logic. All of you
Hmm.
who are practicing acupuncture know that
Hmm.
there is energy, there is chi, there is prana. And you also know that there are different types of chi. You would also have studied how the chi is made in the body. To simplify, we know that our organ systems
बाबू
make
प्रांजल इधर आई.
particular types of chi. That means the liver is making its own organ chi. The spleen is making its own organ chi, heart, kidneys, etc. And this chi circulates through the blood and does its function. But are we aware that the special organs also make their chi? The special organs are the brain, the uterus, and to some extent the bone marrow. Now, our brain is also modulating and creating some chi, some special chi, which is there in our head. And this chi is most accessible at the suture lines. I will repeat, our head, our scalp is the youngmost organ. Our brain, which is below, inside the skull, is making a special chi which has a powerful impact on the body. And this chi is accessible through the sutures. This is the secret. But we have to know how to use it. Usually, scalp acupuncture is associated with pain management, but we also designed a way where all the channels of the body can be influenced through the scalp. All the organs in the body can be influenced through the scalp. And all the different types of chi in the body can be synchronized through the scalp. That is the beauty of NASA. Now, let me show you something more. Okay, friends, I have done some screen sharing and let us, it is showing a message that it is paused. Just let me go through it again. Yes, here we are. NASA is divided into three parts. First level teaches you how to get instant pain relief. Second level teaches you how to balance organ energies. And the third part teaches you how to balance the elements and higher functions, including mental functions and consciousness. That is the beauty of the science. There are many philosophies available for understanding of scalp acupuncture: Chinese, Japanese, and now NASA. Now, I'll introduce you to a concept that we know microsystems, correct? There is abdominal acupuncture, scalp, ear, face, hand, foot. All these are microsystems, and it is believed that the microsystems can help you control the whole body. But what is important is to understand energy circuits. Now, energy flows through our body in defined patterns. So there are general body circuits which cover the whole body, and then there are local circuits. This differentiation is important. General body circuits, as you see in the diagram, it crosses the pathways through the whole body, and there are local circuits, microsystems. So we will have to combine general circuits with microcircuits. That is the secret. So in NASA, we combine the scalp energy circuits with general acupuncture level circuits. We harness brain chi, we create effective patterns, and we have its application in pain management, neurological disorders, and many psychosomatic illnesses. Now, I'll show you something more. Can you see this geometrical diagram? Now, this is very important. When you use the points in a geometrical pattern, like you see the points on the scalp, all right, there are points at due 20, there are points lower than that, but there are also points along the back, dorsal of the back, the spine, and they are all connected in a particular geometrical pattern. Now, this is the beauty of NASA. These are the special circuits which give special effects. So, friends, you have to understand that you have to combine the healing energies of general circuits with the local circuits. So, we are at a point where we are continuously upgrading our knowledge. We are continuously trying to give better results. And we have to do it scientifically, with understanding, with logic. It is not very advisable to give textbook formulas. Okay, this point is good for this problem, or this point or combination is good for this disease. That is not the proper way to practice acupuncture. Secondly, the microsystems have to be understood. Their energies have to be understood. So when you are treating the points on your, say, hand and feet, there are some practitioners who practice microsystems of the hand and feet. But you have to understand that these are small circuits which have to be connected to the larger circuits. This is not happening properly. So the microsystem stimulation can give you some result, but if it is not connected to the larger circuits, the results will never be to your satisfaction. So please understand that the energy science, the energy circuits have to be tapped precisely. And when you stimulate the energy in the microsystem, It is very powerful, and you have to actually allow that energy to flow into your main system. That is the secret. And that is what is our intention to teach you this particular science. In our earlier AcuTalk, there was always a request for a workshop. And that is why this time we have arranged for a workshop on 10th of February. 11th of February is our Aspicon, and a day prior to that is a full day workshop on level 1 of scalp acupuncture, where you'll be able to learn instant pain management. Like Dr. Chirag just mentioned, that couple of cases which were very difficult, they could get instant relief. And you imagine the happiness of those patients. And you imagine the happiness of the practitioner when he gives the result. So friends, I will summarize this and then we'll take up some questions. That microsystems are micro energy systems. Don't look at those microsystems as points. These microsystems make their own energy. Remember this. Now that energy you have to combine with your main energy pool. That is the secret. Combine microsystem energy, general energy. Combine. Form a circuit. And these circuits are available in geometrical patterns, and that gives it the power. And with that, you can do anything, which I just mentioned. You can treat pain, you can treat general organ energies and organ illnesses, you can treat higher problems, elemental imbalances, and also mental condition, psychosomatic condition. These are the three levels available with NASA. So friends, don't look at scalp acupuncture as just stimulating a brain point. Look at scalp acupuncture as stimulating some micro energy, activating it and bringing it into the mainstream. This yang energy can do wonders. You can do wonders with yang. Yang and yin are of course interrelated. There is a lot of logic behind it. When it is yang, when it is yin, how does it convert into elements is a big science, and which is available for you to learn. So with this, I open up the group for the chatting. Let me open up the thing.
बूटा धर दिया दूध बूटा धर दो
There are people who have asked questions. So first, I will ask Bindu to pose her question. Yes, Bindu? Go ahead.
Sir,
Yes, please.
sir, I was late to enter the link. I got the link later, so I could not enter it earlier, and I'm from Kerala.
Okay.
And to attend the practical class on the date you said on February 9th, all that days, I'm far away, so is there any recordings for that day class?
Bindu, we will discuss a question on the subject. Okay. This we will discuss it later. All right. So
Okay.
I'll answer that later. Yes, please. Raja Gopalan, please. Raja Gopalan Nair, please. You have raised your hand. Please ask your question. Okay, I think he's not there. Yes, please. Yes. Yes, Mr. Raja Gopalan. Good evening.
Yeah. See, I am using this. Mr. Chirag sir told us to a hairline that treatment for the shoulder. No, it is very effective. It is.
Okay.
It is given. It is very nice effective. This hairline treatment.
Correct.
I am practicing here. I am tried so many patients. It's a very very nice. This effective. It is.
Correct.
Okay,
What
thank
is
you.
your
Thank you.
question? What is
Yeah,
your
only just I
question?
was. I don't know no other questions.
All right. Okay. Okay. Hiral, you can ask your question, please.
Yes, sir. Good evening, sir.
Good evening.
Sir, just one question.
Yes.
With this NASA therapy, we have to use TCM points also along with that, or just NASA is enough in its own? Like,
Well, I mentioned a concept, right? That microsystem is micro energy, and then there is the macro energy. All right. So in NASA, we use microsystems. Sometimes that is enough, but when you combine the microsystem with the macro system of the whole body, that gives a much powerful effect. All right. So you can combine the scalp microsystem with some body points, but in that geometrical pattern what I showed you, okay, as a picture, as a diagram. So when we create a circuit, you have to create circuits. Always remember, in acupuncture therapy, you have to create circuits. And when you create a proper circuit, the energy flows and it does the healing in a proper way. All right. So there are some methods by which you can combine, okay, the general points also along with the scalp points. All right. So that is what we are teaching all these things in our workshop on 10th February. All those who are interested can contact us and join for the workshop. And for the ASPIC on the 10th and 11th of February are the dates. All right?
Sure. Thank you.
Yes, thank you. Yes, Smita, you have raised your hand.
Yes, hello, doctor.
Yes.
I have one question.
Yes.
On 10th of February, you are taking one workshop for scalp acupuncture, right?
Yes, full day workshop.
Yeah, but you are providing notes and all diagrams.
Everything. Notes, diagrams, kit, whatever gadgetry you need to use as a point tester, everything will be provided.
Okay. Thank you, sir.
Yeah. Yes. Any other questions in the group? So, friends, we are now embarking on a very, very powerful system. Okay. This is the first time that we have found the beauty of combining micro energy with macro energy. This is the beauty. All right. So we have two more questions. Dr. Pritam, please.
Yeah, sir. Hello.
Yes.
Hello. Am I audible, sir?
Yeah, you are audible. Go
Sir,
ahead.
can we do electroacupuncture on scalp? Yeah. Can we do electroacupuncture on scalp points? Hello.
Well, yeah, I can hear you.
Hello.
Yeah, I can hear you. In general, people are doing electroacupuncture on the scalp points, and mainly electroacupuncture is being used for traditional Chinese format. But what we have found is the traditional Chinese format is on the smooth surface of the bone, where the effect is a bit less because it is less powerful, and hence people use the electrostimulation. But with NASA, the electrostimulation is not required. You are getting the benefit without the electroacupuncture. Okay, so it is not required. Okay, you can use it, but we have found that it is working, better in spite of, not using any machine. All right? Yes, please. Anybody else? Radha, you have spoken, right? Any other questions? Any other questions, please? Okay, I think we have covered everyone, all those who have raised their hands. Okay.
Hello.
Yes, please.
Yeah. Yeah, sir. Is there any special kinds of needle to insert in the scalp? Hello.
Yes.
Is there any special kinds of needle inserted into the scalp?
Yeah. Yeah, there are different kinds of needles that are used for treating the scalp points in different areas. All right. So there are very small micro needles on some points, and there are bigger needles on some points. So we I can explain the logic where you have to use the small needles, where you have to use the larger needles, how to create the circuits. All this is explained in NASA therapy. Okay. So usually there are points around the ear. There we use the smaller needles. There are points along the suture line. There some bigger needles are also used.
Okay.
All right.
Okay, sir. Thank you.
Yeah.
Yeah. Thank you, sir.
Yes, please. Any other question, please? Yes, please go ahead. Any other questions?
Sir, can you share today's recordings on YouTube or on
Yeah, we will share it. Okay.
Okay, sir.
Yeah. Any other query, please? All right, friends. So let us come to a conclusion on the presentation of scalp acupuncture. Let me remind you that you have to practice acupuncture in a very, very scientific way. Okay? And this concept of micro energies and macro energies is working wonderfully. Use the microsystems to stimulate micro energies and also combine it with the macro energy systems, and you will be doing a fantastic job. So with this, once again, a reminder, 10th February, a full day workshop on scalp acupuncture. We call it NASA, New Advanced Scalp Acupuncture. And on 11th February, ASPICON, the annual event, which is full of practical workshops. It is not just theory, it's full of practical workshops, and we will be teaching many things there. So see you at these events and hope you enjoyed today's introduction to scalp acupuncture. With this, I conclude the session. Thank you. Have a good day. Have a good night.